And on to our big story now. Drive for precautionary doses for all adults begins from today. And these booster doses are available for all those above 18 citizens who have completed 9 months after the administration of the second dose of COVID vaccine. The Health Ministry has emphasized that booster shots will be the same as the vaccine which has been taken earlier by the person, and private hospitals can levy a maximum of ₹150 as service charge. Remember, Bharat Biotech and Serum Institute both have slashed the prices of Covishield and Covaxin for hospitals to ₹225 per dose. Precaution doses for all frontline healthcare workers and above 60 population will continue to roll out in government vaccination centers. In fact, our reporters are joining us from different corners of the country to help us understand what exactly has been the response like to these booster shots that we are talking about. Akanksha is joining us from Felix Hospital, Noida. We also have Shweta, who is joining us from Navi Mumbai, Apollo Hospital. In fact, Dharani is also with us from Apollo Hospital in Chennai. And Neha Hebale is also joining us from Bengaluru. Let me go across to Akanksha first, joining us from the city of Noida. Akanksha, the booster shot rollout begins from today. Today is a Sunday. It's an off day for most of the people. So any idea as to how has been the response like? I'm assuming it is too early to expect a lot of people at the centers at this point in time, but any numbers that we can look at to gauge the response?
Well, definitely, it's too early to say how many people are going to come to the hospitals because we came here 15 minutes ago and there are actually no one here. But we are expecting that people will start, the crowd will start trickling in by 9 or 10 o'clock. But in fact, it is a big day for India. From today, all those above 18 years of age will receive their third dose, which is also called as booster or precautionary dose. So, but this is only limited to the private vaccination centers. There are few prerequisites. The person has to be of plus 18 years of age. There has to be a gap of 9 months between the second dose and the third dose, and third, mix and match of vaccine is not allowed. So the second, the vaccine that you took as a second dose has to be the vaccine that you'll be taking for the third dose. As we know that both Covaxin and Covishield, the companies who manufacture them, have slashed the prices by more than half. Now they're available at ₹225. Now this whole move assumes importance. As we saw yesterday, there was a case of XC variant which was reported in Gujarat. Our neighboring countries are also they're also seeing a surge in cases. So this move of allowing the booster dose to a lot of people in the country assumes a lot of importance, as we know that last year in 2021 the COVID vaccination process had begun, but exactly a year later booster doses were given to the frontline workers, healthcare workers, and in fact senior citizens, and till now 2.4 crore people have been given the booster doses in India. So today is a big day for India, and we are expecting in some time the crowd will start trickling in the hospitals.
Right, Akanksha, thank you so much for getting us those details from Noida. In fact, let me go across to Navi Mumbai now. Shweta is joining us live from Apollo Hospital. Shweta, good morning. Booster shots for adults actually adds another layer to the entire vaccination program in India. Apart from the regular first and second doses of vaccine to adults, precautionary doses for senior citizens and vaccine to kids are also being administered simultaneously. So with so many layers in place, how are the hospitals, especially the private hospitals and the vaccine centers, managing?
Well, good morning, Gauri. Yes, as far as today the day is concerned, it's a very significant day as we are rolling out vaccination for 18 plus segment, and here it is the time of booster dose, what we also call it as precautionary dose. Remember, it was already there for 60 plus years of group age, and after that it was there for frontliners and health workers. For now, it is meant for youth like me and you, Gauri, and here we are at Apollo Hospital, and this is one of the biggest hospital here. In fact, fact. But sadly, we can just find very low response here, and it might be due to the day because it's Sunday, it's weekend, and people must be relaxing at their home. But yes, the enthusiasm might be seen post 10, I assume, and after that it has also been found out, Gauri, that many of the hospitals are planning, and they are into the planning and procurement of these precautionary doses from Monday onwards. In fact, Sunday, very few hospitals are ready to administer the precautionary dose, which is meant for 18 plus age group. But as of now, we spoke to several of the hospitals, and the planning is going on. They are also fixing up the price, as they are getting for 225 rupees. So this is first ever private hospitals are taking the charge, and the booster doses for the people are on their shoulders, and later on it will be coming to, of course, to the government hospitals. But as of now, this responsibility has been given to private hospitals, and they are being ready, in fact, I can say, for administering these doses. Gauri.
Right, that's right. Shweta, thank you so much for getting us those details. Let me go across to Dharini now, joining us live from the city of Chennai. Dharini, good morning. What is the situation like in the city of Chennai? Hospitals, actually, we need to highlight that got very, very less time to prepare for this particular phase of vaccination. So any issues because of that?
Good morning. As you told, it's a big day for India, as 18 plus population will be able to administer booster dose from today. But however, sadly, when we spoke to most of the well-known private hospitals here in Chennai, they are telling that they won't be able to administer the booster dose today. The main reasons being cited are unpreparedness and limited stock. Most of the private hospitals here in Chennai say that they do not have the stock to administer a huge population of citizens for booster dose. So they are telling that they might be able to administer it by tomorrow or day after tomorrow, but definitely not today. And although, however, a small amount of private hospitals that are not well known, they are ready to administer booster doses here. It's also important to note that the Tamil Nadu Health Ministry, yesterday evening, they had listed out a set of guidelines for private hospitals to be followed while administering the booster dose. In that, they mentioned that the private hospitals should not be collecting any additional money apart from the vaccine price and the 150 rupees service charge. And if any private hospital is found to be violating this particular rule, the minister had warned of a stern action. However, as we were talking earlier, today is Sunday and it's a weekend. People might be relaxing at their houses, and the population that is yet to be turned out at private hospitals for booster dose is expected to be very less. However, when we talk to the officials here in the private hospitals, they tell that might be tomorrow or day after tomorrow, the hospitals will also be ready to administer booster dose to a huge population, and that people might also be interested in coming to the hospitals and taking the booster dose. Also, the hospitals tell that they're unprepared for this act. It's only yesterday evening around 6:10 p.m. the Tamil Nadu Health Ministry issued a set of guidelines for private hospitals. So the hospitals tell that they are unprepared, and they do not have enough time to take all the necessary steps that need to be made for the administration. So the hospitals tell that it will be at least taking another 1 or 2 days for them to get prepared for this mega vaccination drive. It's also important to notice that the Tamil Nadu government, after successfully conducting 27 mega vaccination drives, had announced yesterday that the state will not be conducting any more vaccination drives, especially for this COVID vaccination. However, people of all age groups above 18 plus, they can walk into any private or government hospital at any point of time and have their first dose, second dose, or even booster dose. Back to you.
Right, Dharini, thank you so much for getting us all those updates and very important issues that Dharini was actually conveying to all our viewers, that how the hospitals are actually facing a lot of issues because of paucity of time. Let me go across to Neha now, who is joining us from the city of Bengaluru. Neha, good morning. We just heard Dharini giving us a lowdown as to what are the issues being faced in the city of Chennai as far as booster shots rollout is concerned. Most hospitals are saying that they won't be able to start the drive today onwards as they need more time to prepare. Is the situation pretty much similar in the city of Bengaluru as well?
Well,
absolutely, Gauri. Several private hospitals whom we spoke to, in fact, in conversation with last evening, also did mention that, this entire drive of the booster doses for 18 plus was just announced in a hurry without, really allowing the hospitals any time to prepare. In fact, I'd like to give you clarity. We're at, St. Philomena's Hospital, which is one of Bengaluru's oldest hospitals. It was established almost in about, close to 1940. This hospital has been administering vaccinations to people who are in need of it. However, today, you can actually see how the hospital too, much like most other private hospitals, isn't administering the vaccine. Now, primarily, Gauri, what private hospitals, larger private hospitals over here are saying is that, for starters, there is an issue with the price of the vaccination itself, since we already know that both, in fact, Serum Institute as well as Bharat Biotech slashed their prices last minute, which is now, in fact, put private hospitals in a limbo, since let's remind you that they've purchased it at a higher price, is what they say, which is why now many private hospitals are still disputing how much they should really be administering the vaccines for. The second also being the fact that there are several private hospitals which don't have stocks at the moment of, to be able to administer for the booster dose, which was supposed to begin today. And also, in fact, like we saw in Mumbai, or like we saw in Noida, like we saw in Chennai for that matter, it is still, of course, 8:30 at the moment. And, it is a Sunday, so we'll have to wait and see. But as of yesterday, the registrations that have come in both on the CoWIN portal as well as in terms of, people who've said that they would likely walk in tomorrow and take it, the response too hasn't been that great.
Right. Neha, thank you so much for getting us those updates from the city of Bengaluru. Let's shift our focus to Mumbai now. Sandeep is joining us live from Hinduja Hospital. Sandeep, good morning. We were just talking to Neha Hibale and Dharini. Both were giving us updates from the southern cities of Chennai and Bengaluru. And their hospitals are citing lack of time. And they are saying that they are unprepared to start the drive from today onwards. What is the situation like in Mumbai? And also help us understand what exactly is the situation like when it comes to turnout of the people, because bringing people to the vaccination centers for this particular phase of vaccination is going to be a big challenge, simply because the COVID situation is pretty much under control. So there is no urgent trigger to basically push people for vaccination.
See, indeed, as you rightly pointed out, that the COVID, numbers are very much, down and not increasing much. And as far as Maharashtra and Mumbai is concerned, we have the state government has lifted, in fact, all the restrictions, and in fact, wearing the mask is also made optional out here. So yes, there is a kind of safety and a sense of safety and security before, of any kind of COVID or any kind of disease as of now. But yes, the central government had, announced a drive, booster dose drive. As far as BMC is concerned, and the COVID centers and vaccination centers are concerned of BMC, we spoke to a few people in BMC. They told us that government section has in fact rolled out booster vaccination for healthcare workers and frontline workers. So these schemes are just, made for private hospital. When we spoke to several private hospitals, the major problems that they are facing is of getting the stock. Maximum hospital don't have the booster doses stocks, whereas as far as my location is concerned, Hinduja Hospital has confirmed that they have doses, but being a Sunday, a weekend day, they will be starting in some time, although they haven't they haven't given confirmation over the rollout of, the beneficiary, how many beneficiary have enrolled as of now. But yes, they have started, they will be starting the center shortly in some time, and we will have to wait and watch how many people come to take at least the booster dose that is, very much helpful for the health.
Right, that's right. Sandeep, thank you so much for getting us all those details. We will, of course, be coming back to you and all our other reporters for all the latest updates on this big milestone that our vaccination program has achieved today. But several hurdles are also being faced in several of the cities. We will be tracking all of it. Thank you, Sandeep, for joining us from Mumbai. Thank you, Shweta, for giving us updates from Navi Mumbai. And thank you, Neha, for joining us from Bengaluru. With that, we are slipping into a very short break. Lots more lined up on the other side.